Nigeria's multisectoral approach to the HIV and AIDS epidemic has proven effective, with diverse actors playing complementary roles in designing and implementing the national response. However, as the response approaches the last mile, it is imperative that all available tools be deployed, and the media stands as one of the most vital.
What the media has to do can be described in that context of providing the relevant information to ordinary Nigerians, to everyday Nigerians, about not just the prevalence of HIV, but also how they can prevent it and so on. So I think the media's role in that context is to disseminate information through various channels, information gotten from regulators, information gotten from experts. There is a lot of research going on about HIV, for example. There is a whole discussion about the potential vaccine. To do that, it is the duty of the media, which we at Premium Times are doing, to get this information from the relevant bodies, convert them into simple language, because we are not academics and we are not communicating to academics as journalists, communicating to everyday Nigerians.
With its broad reach and influence, the media can significantly enhance awareness, counter social misconceptions and fake news, and challenge stigma, thereby reducing vulnerability to the disease.
The average Nigerian is not media literate. That's why fake news thrives a lot. However, what we must understand is that in this digital age where everybody has essentially become some kind of journalist, it's almost impossible to eradicate fake news. But what institutions like NACA, the Health Ministry and so can do is to partner with credible media organizations such that they ensure that there is no vacuum. In that media space around HIV, there is constant release of credible information, so that whenever anybody wants to bring fake news, it will be drowned by the real news that is already out, not to be reactive.
For stigmatization, if you cast your mind back to the time when HIV was at its peak, in the early 90s, a lot of people saw HIV, AIDS, it's a death sentence, people would not eat with people that had HIV, they would not talk to them, they would, and all that. The media played a very important role and will continue to play that role because we're still in the thick of it. Not totally in the thick, but we hear that we're getting out of it over time. But again, we will not stop until we get to the last mile. So stigmatization is still in the community, but as journalists, we still can't help to reduce this. We join us with the government to reduce stigmatization by educating the people, letting them know that, see, these people with HIV are still human beings. They even can live long as every other person if all things remain equal. All they need to do is to take their drugs, they will not transmit it to you, and they will not die. So that's it.
The National Agency for the Control of AIDS, NACA, has been proactive in addressing potential gaps in HIV and AIDS communication. Over the years, it has engaged media organizations through initiatives such as the establishment of the National HIV Media Advocacy Platform, comprising media representatives, NACA's PR unit, and zonal coordinators, alongside organizing targeted capacity-building workshops for health journalists on social and behavioral change communication in HIV advocacy. The agency has also facilitated greater media access to healthcare facilities and individuals living with HIV, empowering journalists craft compelling, human-centered stories that foster awareness, empathy, and a deeper understanding of the epidemic.
We want to provide opportunities for the media to obtain direct answers to their questions from the caregivers, from people living with HIV, from the DG herself. Then we want them to have a sort of human handle to their stories. Talking to somebody living with HIV, telling us their stories, their challenges, how they are able to overcome the stigma and discrimination. It's appeals to no one. You want to read the story, you want to ask, because this is somebody telling us story. Then we want to put a face to the figures we are throwing around. And apart from that, we hear Global saying, we supported Nigeria with $2 billion. Let them know where the dollars are going. Let them know where the money is going. Where the money, by the time they go to the facility and it's talking down to them, they know where the money is going.
We went to NACA, the Nasarawa State Agency for the Control of AIDS. From there, we went to the specialist hospital where we were taken through the rudiments of HIV testing, what they do when they arrive at the hospital. They are taken from the testing arena to the counseling, to the treatment, to the pharmacy, where they get everything that they need in one place. And they also advocated for increased sensitization and enlightenment so that people can actually come and access treatment, which is free.
One fascinating thing for me is how they even track, the those with HIV. The details, like looking for them and making sure that they actually get the treatment, and also they have a documentation system whereby they document everything they have concerning HIV. I'm very glad, first of all, to be part of this tour, because that's really opened my eye to, change my perception. I saw a lot of things, a lot of work being done here, a lot of things that needs to be done. And basically the message is the fact that I'm going to tell the story that, look, people are really working at the grassroots, even though they still need, more investment in the area of in equipment. They need more support, even from the federal, even from the states, because the states really drive this program. So more investment in the area of, driving the message to stop stigmatization, investment to give more people the room to be treated, to have more access to HIV and AIDS services.
The concept, right? The motivation for this field trip by DG and our team, I think it's very, not just innovative, but then very impactful. It is an eye-opener for me personally. I'm new to the beat. I haven't done this before, but then I have the opportunity to have a feel of what we are even talking about. Not that I don't have an idea, but then seeing the people and seeing how healthy they are, then for them to now tell us what it takes for them to be at this situation, right? It is a good one that I think other CEOs that their responsibilities, their mandates have to, do with the grassroots should emulate.
For me, it's an eye-opening tour field trip. The fact that I'm able to put faces to the figures we mentioned when writing stories, because now you've seen the faces, you've seen the lives that have been mentioned with numbers. Now you can tell through their eyes, you can see through their eyes and how they feel, and you can feel what they feel and how the society treats them and how they've been coping and how they've been living in the country. So definitely when you put that into writing, it's going to change the perspective of others, and even others who are yet to come out to speak about their status can be encouraged to come out to do so.
While the media has been an indispensable ally and made significant contributions to the HIV and AIDS response, it must remain steadfast, as sustained and impactful coverage is more crucial than ever to Nigeria's goal of ending the epidemic by 2030.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.